Greetings, everybody. It's Tuesday, the 13th of June, 2023, 5 p.m. We are meeting remotely via Zoom. This is the Advisory Board of Health meeting. Call to order, it's 5:04 p.m. First order of business is to review and approve the March minutes, which were distributed prior and have been on our website. Any changes or amendments to the March minutes? Okay, assume everybody approves. Okay, unanimously approved. Thank you. Second order of business, director report. Throw it over to you, David.
All right, well, thanks everybody for being able to attend this meeting. First order of business that I'd like to report on is our food code regulation update. As you know, we've been talking for years about the imminent adoption in Connecticut of the FDA food code. And sure enough, come February, this past February, the state did go forward, and it is now the rule of land. At our last meeting, we reviewed proposed fee schedule changes, and the board approved those. I brought them to the Board of Selectmen, and they also approved them. So subsequent to that, we needed to update our regulations, and because there were a lot of things in the old regulations that didn't pertain to FDA. Excuse me. The regulations that we proposed were submitted to town council. They made several recommendations, some formatting issues, and we've incorporated all those comments, and I've submitted them to you for your review. This does not need to go to RTM for approval. Basically just needs your okay, and then I sign it, and it becomes our regulation, health department regulation for the town. Now, it's important to note that this really doesn't change and make life any more difficult for our facilities, but it has made it several changes to us in how we do business, because there's been a complete change in the inspection process, which we had talked about before, which no longer has a score associated with the inspection forms. So we have a learning curve with the new forms. There have been some changes in the regulations, as I mentioned. I just like to go through them in order. The first thing was definitions, some definition changes. We have always classified our food service facilities based on the complexity of the menu, with the more detailed menus having the highest inspection frequency because they were considered to be the greatest risk. That's sort of the same way it still is, except now the class 4 facilities are now defined as serving those facilities that serve special populations, our extended living facilities, the senior center, and nursery schools. There's not that many that are class 4s. Most of our facilities used to be class 4s. So again, there's definition changes. We had to reclassify the restaurants. As you know, we adjusted our fee schedule accordingly, and we're working with that here. The inspection report, again, is no longer based on score, and violations are now evaluated instead of a point system. They're evaluated using terms priority, which are the most serious in terms of risk, priority foundation, which are the next lower category, and core. The next part of the inspection or the regulations that have significant changes has to do with inspection reports, availability, and ratings. The inspection reports now contain a specific time frame for correction of violations. That would be priority violations. It's a 3-day. They have to fix it within 3 days. So that means we either have to go back in 3 days to fix it. They can fix it on site, which is the ideal thing, or they provide us with documentation of how a priority item was taken care of. For example, how it could be fixed without us necessarily going back would be as if a dishwasher sanitizer was out or it wasn't adequately sanitizing. They could provide us with a written invoice that this thing had been fixed, and we don't necessarily have to go back. I can assure you our intent is to verify. I mean, it's easy to send us a paper with an invoice, but doesn't necessarily mean the work was done. So it's our intent always to follow up in person, but sometimes, the delays come into play. But another thing is we mentioned in the last meeting, we have suspended ratings for the time being until we're really familiar with the inspection form and how our enforcement program works. But what we do have is we still have the inspection reports being posted online, and there is a placard that we're requiring be placed where the ratings used to be that enable patrons, that inform patrons actually that inspection reports are accessible in the facility for their viewing if they choose, and also has the QR code to get to our website to look at the most recent, or actually the historical perspective of inspections as well.
So, David, just to clarify that part about the inspections and the ratings, will you continue to do like an A, B, and C rating?
That we're hoping to be able to do that. Yes.
Mm-hmm.
I mean, there are other jurisdictions that are using the FDA food code to do ratings, and the thing is that I want to make sure that we're all comfortable with doing the inspections in a kind of a uniform fashion before we started, assigning a rating to it. As long as people can still view the inspection reports, I think that's providing information that's useful to the public. We're still getting a pretty consistent viewing of the inspections on our website because we do get weekly summaries of viewings for inspection reports. So people are utilizing, are accessing and looking at inspection reports on our website. I trust this the public. I know that I don't look at it that often, so it's not me, bumping up the numbers. But no, seriously, it does look like it's getting public usage, at least as much, the same as what it was when we were still issuing ratings. I do hope, Mac, that we can get back to actually issuing the A, Bs, and Cs in the fall. That's our goal.
Yeah, it's just that, you walk into a deli, that's kind of the one thing you look at walking in and you see an A, you just, it makes you feel comfortable versus a C.
I know. I like it, and I've liked it. And I was recently in the city, and there were two places next to each other. One had a B and one had an A. So we didn't go to the one with the B. So it does make a difference, and we do want to get back to that. But I want to make sure that we're really clear in how we're going to. The next step for us is after we're comfortable with actually doing using the inspection forms, is to get a consensus as to what it means in terms of giving a rating. And we're also going to work with other jurisdictions that had been doing ratings in the past to try to have uniformity in Connecticut as to how that's being done. Because this is not endorsed by the state health department, by the way. This was done independently by local health departments because we felt this was a message the public needed to see. And the state is not necessarily in agreement or supportive of the ratings, public ratings. Never has been. And finally, the big thing about this is, and I know we had a lengthy conversation about this at our last meeting, was how are we going to enforce things if there's no longer a failing score and scoring is not part of the resulting inspection summary. People always want to know, did I pass or did I fail? So we had to come up with a whole new scheme of enforcement, and it's based on the priority, how many priority violations and hearings, and hearing fee would be part of it. So, and again, we've run all the enforcement and actually the regulations through our town attorney, and they've totally supportive of our approach in how to do enforcement. We've already utilized the hearing process a couple of times since we've switched over. So I did circulate the regulations. Those are the highlights of the changes. And I just ask that you, if there's any questions, if we can have a vote so we can move forward with making the changes that we need to make.
Any questions on the food regulation changes?
So I saw in the regulations there were the option to suspend or revoke a license, and an option to request a hearing or things like that. Is all that the same as before?
Yes.
Or is any of that new?
No, that's not new.
Okay.
That has always been there. The tricky part was coming up with the enforcement part of the priority violations and timeframes and lack of time frame.
Right.
That was the tricky part. But the hearings and suspensions and revocation, that's the same language. We didn't even change that.
Okay. And you mentioned ahead that, or you suggest this could be more work for your department.
Well, it's like anything else that's new. It's getting used to it. And the part about requiring and understanding how to follow up on a violation that now has a 3-day defined window for correction. Now, we've always taken the policy that if something is what we consider to be a risk to public health, we don't wait the prescribed time that the health code used to give, which was 10 days to 2 weeks.
Mm-hmm.
We'd go in the next day, if it was something significant anyway. So it doesn't really change how we do business, but there are many more, quote, priority violations than there were 4-point demerit items, let's say, in the past. So this code it's a lot more prescriptive. So it's about familiarizing ourselves with all the categories and subcategories. The form itself has 58 violations, but each one of those 58 violations can have subcategories of violations that have different levels of risk associated with them. And so it can be as many as 25 or 30 sub violations under a single heading that we are kind of filtering through when we're doing our inspection form. So it takes us longer right now to do the inspections because there's a lot more subcategories that we're looking at. But like with anything else, as we do more often, we'll become more familiar and facile and be able to do the inspections and fill out the forms faster. When we first started doing these things, we actually would make notes and come back to the office to fill out the forms because we didn't want to look like what we were doing when we were doing the inspections. Because it was like going back and forth and checking references and so on. So it was tedious, but I think we're getting better. We're getting better.
But it sounds like you're suggesting even once everyone's familiar with the regulations, because of the number of things and subcategories to consider, the average inspection time may take longer.
Yep.
Okay.
Yep. Without a doubt.
I asked because whenever I have a new regulation, my next stop is to get more budget.
So that brings us to the next item. Oh, before we do we have a vote on that yet?
So can I just
No, not yet.
Okay, more
Yeah.
discussion.
Yeah, I just wanted to ask, is there any kind of reliability checks when you do the inspection, say, for example, have two inspectors and fill out their own report at the same time, you know, not to communicate with one another, but independently to see if there's some kind of internal consistency in the reporting?
Well, first of all, I review all inspection reports. They all come to me. And so, you know, we have internal conversations regularly to review the inspection reports. We don't really have the luxury of having staff be able to go into, two people go into the same place at the same time. So what we do is we have the internal conversations amongst the three of us who are doing the reviews or the inspections. And that's how we're doing it. Plus, we're interacting with other departments who are doing inspections. There are two other departments in Connecticut that utilize the same software system that we do. And that's been really helpful because, you know, the thing was created the same for the three departments. And I know that there are several other departments that are interested in getting on board with this software system because just to try to create some uniformity in Connecticut, because the whole intent of the FDA code was to try to get everybody on the same page. But, you know, there's so many, the training window for training from the state has not been, shall I say, particularly effective. So there's a lot of variation. And Christine, you're right. It's really hard to make sure that there's consistency. So that's why we're having regular sit-down discussions to go over these inspection reports, figuring out where to put things.
Yeah, to see where you're on the same page.
You know, yeah, you know, just say, we saw this at such and such a place. Do you think I put it in the right place? Is this the right, is this where I put it? Is it really a priority, or could it be a priority foundation?
Right.
And the core violations are 90 days, you know, so it's, you know, the priority foundations are 10 days. So, you know, that's why I said, Andy, you know, that it's going to be a little tricky for us to figure out how to do some of these re-inspections consistently, you know, when you have the different timeframes for correction.
How many?
And is the law require you to do the re-inspection within that time frame, or can you go beyond that if, you know, you've got too many other inspections to do?
The code has a specific 72-hour correction timeline for priority. It doesn't really say, well, you know, you can let it go. No, there's not really any leeway in that. We're supposed to make sure that these things are taken care of in that period of time.
Okay.
How many inspectors do you have on now? Two,
well,
correct?
Yes. Well, we have one part-time person who works 2 days a week.
Right.
And we have Mindy who does everything, septic, you know, and, you know, I mean, just everything else. So we really only have a part-time, 2 day a week, part-time, not even fully 6 hours a day, dedicated to doing food. And he now is doing the beach water sampling and also doing some pool testing.
Busy guy.
Yeah, well, you know, I think that's one of the penalties of being efficient and good at what you do. You know, we get it done, and I think I know we're doing a good job. You know, but we could definitely use additional staff. I've been asking for it consistently, and that's another topic coming up.
Yeah, hopefully that will happen soon.
Yeah, sooner rather than later. Matt,
Right.
Did you have a question? No. So can we request a motion for a vote on this?
Motion for a vote. Everybody, motion for approval for food regulation changes. Matt.
I motion.
Oh, Andy, thank you. On favor? Unanimously approved. Thanks, David.
Thank you. So I continue moving forward in my quest on reorganizing the department. I have, since our last meeting, I have learned that there have been grant funds made available to local health departments for workforce development. And there's a broad spectrum of things that could be used for. It could be used for enhancing salaries of existing employees, employee retention, adding staff. You know, for us, it's about $45,000, and I have a period of time to use it in. But I can use it up sooner, and I think it's a 1.5-year time frame to use this funds, and it's a one-shot deal. So what I've proposed to our town administrator is to use that money to basically fund a position from now until January, so that we could hire a new full-time sanitarian. We have another part-time specialist who does plan reviews, and she's been fantastic. But she's told me that, you know, not to count on her being around for that much longer. Now, she left it open, but it has to do with certain family matters. And she's been great, but she's not going to be here, you know, through the winter. So it's really important that we get somebody on board sooner rather than later. So between the savings of the part-time person, between this and this grant funding, and the fact that we do have monies in the budget that would have hired a person come January, I have reinitiated my request to the town manager that we utilize the grant funds to hire someone now, like not wait. And I've not gotten a definitive answer. I've gotten a lot of questions, and I'm kind of stymied because it's a grant fund. It's grant money that I could use for this position. It's not asking the town for any additional funds that have already been allocated. So that's, and again, this is not a new request. And it's not that I didn't anticipate the need for this position based on the new facilities that are coming. We have 14 new facilities that we're working on right now, restaurants alone. You know, and there's more to come. We don't even know what's going to go into the Palmer's places or the rest of what's going in downtown. To say nothing of all the other new buildings that are going up in various locations around the community. Great for the town, but you know, it's time, and it takes expertise, and we can't just hire someone who is, you know, new to the field and train them and expect them to perform up to the levels that we're used to having right now. So we really need to have somebody on board sooner rather than later, preferably while Lori is still with us. And so I don't know if there's, I hesitate to ask, you know, for you to reach out to Kate or anybody, you know, on the behalf of moving this forward. But I just wanted to impress upon the board here that, you know, this is not something new that I've asking for. This is a renewal of a request that I've had in the last 2 budget cycles to fund this position. And as you said, Andy, you know, it's taking us longer to do the regular inspections now anyway. I don't anticipate that, you know, yes, we'll get better at it, but even when we get better at it, the nature of this type of inspection form is to really get more in depth with the work we do in our follow-ups. So just by definition, it's going to take us more time. And the other piece to the departmental organization that I think is important is I really would like to add an assistant director of health. I know that this is something that you folks all reviewed and approved when we made our budget request back in December. But that didn't go anywhere. And I just want to emphasize how things have changed in the environment and in our mandated responsibilities. One of the things we're supposed to be doing as a local health department is having regular trainings on suicide prevention. I mean, that's a program we should do. There's grant funds available for opiate work. There's smoking cessation programs. We can't do that with the staff we have. We'll be stretched to do it if we added a full-time sanitarian and an assistant director of health, but we may be able to, with a full-time other person, we can spread out the work a little bit more so that we could take on some more initiative-based programs. Marijuana awareness, some educational work on marijuana. In particular, I'm concerned about edibles. These are things that we as a health department, programs that we as a health department absolutely cannot do in our current structure. And, going forward in 2023, 2024, these are things we need to do. These are things we should be doing. I know that other departments in town have added staff, fire marshal, building department, zoning. And, we have an awful lot of responsibilities. And as you can see, as we talk about every time we get together and in the reports I provide to the selectmen, we cover a lot of ground. Public health.
David, the thing is that those other departments you mentioned that now have more assistance, they have to do inspections also.
They do.
So it's that's the reason, and there's no reason why you shouldn't have that same request fulfilled.
Exactly.
So what's been? Do you have any sense of the reason for kind of the resistance to approval here? Why were things not approved previously, or what could be the going forward the reasons to not approve? Do you have any insights?
The example or the explanation that was given to me was there were a lot of competing needs, and whoever determines priorities determined that our department, I guess, wasn't the priority. I guess that's the best way I could explain it. Maybe I wasn't convincing enough, so.
I think in general, don't you think, David and people, is that public health is so much behind the scenes that people really are not aware or have any understanding of how much is involved and what's needed. And so I think it's just historically, they're just not getting the kind of funding that other more visible kind of organizations or departments get.
Yeah, the public health departments don't get noticed until something bad happens.
Until we have a crisis, right?
Yeah, and so we did have a crisis, and I thought we did a pretty good job in responding to it. It's called the pandemic. And, and I think, again, our very small department, I thought, did an unbelievable job in responding to that. And that could have been to our detriment, with so few people, that we were able to do as much as we did. And,
you were also able to rally tremendous volunteer effort. And
absolutely,
I'm not sure the other departments you're alluding to in the town get volunteers to do their work.
Well, that was outside the scope of normal work, but, in terms of the work that we have to do right now, I'm saying that I don't see how we're going to be able to do it going down the road, especially if our plan review specialist was to leave soon. We just won't be able to do it. We won't be able to do what we are mandated to do without having somebody else on board that knows what they're doing. And I did ask our part-time food service inspector if he'd be willing to add to his hours, and he said, no, thank you. So, so he's, you know, he's got his 6 hours, 2 days a week, and that's all that's his limit. He's retired, you know, and we're fortunate to have him. And he's reliable, and he's been fantastic working through learning this new FDA food code. I wasn't sure he was going to want to stick around because it's a lot to take on when you're used to doing something a particular way, and all of a sudden you're thrown into a whole new realm of how to do your job. So anyway, that's kind of that's the situation that I see that we're in right now. We're in kind of a crisis mode, and I'm not sure how to push forward without pushing too hard and creating a different kind of a problem. But it's just important that we do something, and the grant money's there. So I'll move on to staff update. Mindy.
Well, before we move on though,
Okay.
just thinking about, you know, what form of support we could provide, you know, maybe a joint letter or something like that. Just brainstorming here. But do you think that would help?
I think that I'll leave that up to you.
Okay.
You know, and I mean, the reality, I'm having this conversation, we're having this conversation, I'm presenting to you the concerns that I have, and, you know, I'll leave it at that.
And is there request for budget? Is that, I mean, I don't really know how this works. Is that done at any time during the year, or is it only at certain times during the year that request for budget is entertained?
I'm not even asking for a budget request here. This is
just
this would be grant.
right.
Grant. It's a personnel matter, and it's not going to cost the town anything. So it's not really a budget issue. I'm not
Okay.
that's the beauty of this. The timing with the grant enables us to hire somebody sooner rather than later. If without the grant, then it would be a budget matter. But
I got it.
The grant and it's kind of like no strings attached. You know, it's not really a problem. It's just a personnel issue.
Got it. Yeah, you mentioned that. What's the timing for the grant? When does a decision have to be made by, or an application made by?
This is actually not it's like it's not a grant. I don't have to apply. There's no strings attached. It's through the federal government, and it's for public health workforce development specifically. So it's one of these things where it's an unusual allocation of funds. And you know, it's given on they figured out a formula sort of per capita. So every municipality is getting money for public health workforce development. Don't know when it's coming. It may not come until the fall, but there's a definite, there was notice was sent, the monies, we know how much money we're getting, and we just don't know when, but it's there.
So we just need to get them to acknowledge and allocate it, David?
No, they've
When it comes?
acknowledged that the money's coming. It's just I need to have somebody say, okay, you can hire somebody now.
So the money's coming to Department of Health, right?
Yes.
Not the town. Okay.
Yeah.
So it's approval to, I got it.
And that's, you know, we have a couple funds that we have monies that have been sent to the health department that are in health department kind of little drawers. Funds is another one. We have money from ARPA funds. We have money from opioid relief funding, and we have enhanced laboratory capability, ELC2 funds. So we have money in these different accounts. I just need to be able to utilize them to do what I think we need to do to enhance the functionality of the department. So
David,
in this
the money's
particular-
sitting there?
It's not there yet.
Okay, so is it possible that they're just waiting for timing and delivery of those funds?
No.
Okay.
Because we have money in our budget, we could move it around and utilize it
And supplant that?
until the grant money comes in. So it's not
Okay.
like, there's no money there, because we have plenty of money in the full-time account. And by the time that money comes in, we just put it back into the full-time account. So it's not a problem with paying for the position. The monies will be coming. Don't know when. It's just a matter of getting that person in sooner rather than later.
Understood.
And our workload isn't slowing down. There's still, as I said, there's a lot more construction that's sure, we've done a lot so far, but we're not even close to halfway yet. Along those lines, any other discussion of this particular situation?
Well, just so we didn't really, I think, finalize it. So what we might want to do is as a committee draft a letter and give it to the selectmen. Is that who would you want it to go to?
I think the decision maker is Kate.
Okay, and she's the town administrator.
Yes.
Mm-hmm. What do you think, Kevin?
David, how about you and I will chat offline and we'll discuss the best course of action, and I'll take it to the rest of the ABH.
Thank you.
Good.
Okay. I just want to go over some staff updates. Some good things happening. Mindy completed her MPH program, and with that degree, she now meets the statutory requirements to serve as Director of Health. She's been a absolute critical component of the department's functionality and a real asset to the community. I mean, there's no doubt about it. She gets along great, terrific working in the field, and she's always ready to learn. And I really think it's important. There's a lot of demand in Connecticut for people with her qualifications, particularly in their skills, especially as an environmental person. I mean, she has a lot of the skill set that's in very high demand across the state. And I really think it's important that we make some effort to retain her. And again, this is an interesting dynamic situation that I have, and I'm also requesting the reactivation of the Assistant Director of Health position. We had that before. Years back, we had a person who attained his MPH degree and was, as a matter of policy, I guess at the time, I don't even remember how it really happened, but he became the Assistant Director of Health. I'm really hoping that we can move Mindy forward in that position. I've been promoting that and actively working on it. And I think we can utilize some of the funding from the other grant programs to help supplement any pay increases for that position. So I'm trying to navigate that one too. She's worked on some PSA videos, done a great job with them. We have another one coming up next week that we're going to start working on. So she's been working with staff and other local health departments to assimilate changes necessitated by the FDA food code. And, meantime, she's conducting all the regular inspections, septics, food service, pools, those plan reviews, and so on. Our public health part-time, I'll stress that, part-time public health nurse, Paula, has collaborated with the Human Service Director, Allie, to offer training courses in mental health first aid. We've already offered, that's a 2-day program. We've offered it twice, and we have another one coming up in August. And to help out in the field, she has actually started doing cosmetology salon inspections and taking her public health, her nursing infection control expertise and applying it to looking at processes that go on in some of these salons. And it's been a bit of an eye-opening experience to her, to say the least. But that's a valuable asset that we have there, that she's able to help out, because right now Mindy is the only one doing inspections of our salons, and we have 37 of them, with 4 more on the books coming up. Plan reviews for those are being done by Lori remotely, and again, this is it's a dynamic situation that needs to be bolstered because it's tentative at best. Nick Jossam, as you know, Kevin is going to be outfitting the Pod in a Box mobile clinic supply trailer. It is due in at any time, and once it gets here, we'll start outfitting it. Christine, you had asked about our inspectors. Cedric Gu is inspecting food service facilities, public pools, collecting water samples every Monday at our beaches. The results from those water samples are posted online. We maintain a hotline in the event of beach closures, and we are also communicating with Marley Hayes, who's manning the town newsletter on any issues, if there are any, associated with the beaches. I think, as you know, we have a proactive approach of closing beaches if we get over an inch of rain, and we put a notice on the hotline, and Marley will put a notice on the town website in the event of that, when we get rain. And Lori Roman continues performing plan reviews for proposed food service, new ones, renovated ones, and cosmetology salons. And she's been absolutely critical in helping us navigate through the FDA food code. She's a true expert in her field. And finally, we're looking to add a part-time / intern student who I think will really kind of got some interesting ideas, meeting with him last week, perhaps to do some PSA work, do something on safety around home pools, for one thing. Looking into, because he works with Post 53, and we're thinking about how we can incorporate some of the data from Post 53 with maybe some public health improvement programs that we could offer to the community. He had a great perspective on some of the reasons for their calls that I think we could work together with Post and him to come up with some kind of really useful programs.
David, is this Will Olson?
Yep.
Great.
Yep. He came in last week, and I just worry about, the again approach to add a part-time person when I'm looking for other help too. So I have to be really creative in how I come up with paying for a position. He did say he'd be willing to do it as an intern, but I really feel that I'd like to offer some funding for that.
There's plenty of work to do, so we'll
Yep.
figure it out. Okay.
Yep.
You mentioned, I think, in a previous meeting, one of the most common incidents was falling that Post 53 was addressing.
Yeah.
Okay.
And interestingly, which I never knew before speaking with him, was that most of those falls are occurring at our assisted living facilities.
Interesting.
It's true.
Yeah. So, does that mean that, we work with them to come up with some programs within those facilities, or enhance the ones that they have? I mean, so it's something to look at. And that was just, we learned that, in our 20-minute conversation the other day. But we'll pursue that. I'm also looking to move forward on conducting the community health needs assessment. I know we've talked about that for some time. We started doing it in-house, decided that there were too many variables that I didn't want to just have us do. So I wanted a professional concern look at it. I sent you 2 different price quotes and scope of service contracts, proposals, I should say. Very different price estimates between the two. One was 24 and the other was 65,000. We have money for that. That's a grant. That would be fully grant funded. So I just need I submitted them both to Kate for her review because she wanted to review them. I'm hoping that we get the go ahead because that grant funding will expire in March of 24. And
Interesting that the shorter one was the more expensive one.
well, that money's been there all along. I just didn't know what to do with it.
Yeah.
And that actually has been there for 2 years. And it was COVID money. That's really what it is. And, so you may still see a lot of places that are offering COVID clinics and they're pretty much paying to have people sit and nobody comes in, but I don't want to spend money just for nothing. I want to make sure that if we're spending money, we're using it for something worthwhile for the community. And we don't even get anybody calling us about COVID anymore.
Yeah.
Nobody wants it's nothing. It's totally off of everybody's mind in terms of the questions we're asked. So this money, the way I had written the contract application or the grant application was I had some language in there that allowed for an evaluation post-COVID. So that's the connection and that's the angle I really want to go with, is to kind of have this assessment be some form of measurement of the impact that the pandemic had on the community, kind of sort of focusing on the mental health perspective.
Well,
Do we
David,
know sorry, go ahead.
No, just as far as there's, like you said, there's 2 different quotes, but one high, one low. Do you have a preference?
Yeah, I think I'd like to go with the lower one. And it's not just because of the quality. I mean, I have the money to pay for the more expensive one. But, I'm going to leave the financial decision and recommendation to Kate on that because that's what she does and she does well. So, I think that both of those proposals have a pretty good scope of service to them. And I'm confident. And one thing that I was concerned about with even wanting to do this was with all the other things that we have to do as a department, are we really going to be able to do this too? What's the time commitment we'll have to, put forward to do this kind of thing? And the estimate that I got from the 2 entities was, somewhere specifically maybe 10 to 12 hours, from meetings, because they're going to do all the writing. I mean, I'll do the review, we'll do the reviewing, but there's some meetings. And most of those, like this, we could do a lot of that stuff virtually now. We don't have to be in the same physical location. It's one thing out of the pandemic.
Do we know of any satisfied communities for either of these entities?
Yeah, I know that they're working in Wilton right now. I don't want to say cheaper one, the less expensive one. And
Yeah.
the more expensive one did the health needs assessment for the Norwalk Hospital and City of Norwalk. You know, so I know that they're really good. You know, so I didn't get a lot of price quotes. The state said I don't need a bunch of price quotes, and it doesn't have to be reviewed by the state. So we get to choose who we want to have do this report for us without state oversight. We just need to account for the monies.
Okay. Nice.
Yeah. So anyway, that's where we are with that. And I'll await Kate's response. Couple other items that for quick discussion. Drought and the wildfires. That was something last week. That was very scary to me as a public health official. You know, being out on the Sound, taking the ferry and seeing what it looked like out there. And I'm sure anybody who was sitting in the city to see the city disappear before your eyes and everything turn orange and smell, you know, I smell the smoke in my office with the windows closed. We're just so fortunate that the wind direction shifted.
Well, David, I was really impressed with what was on the town website, and I believe we all received like a robocall about it. You know, it wasn't big government telling us what to do, but it was basically giving us information, and especially Wednesday was probably a day you didn't want to be outside.
Yeah, and you know, again, you know, there's some things that we learned from the pandemic, and you know, that is how important communication is. You know, I had to really reach out multiple times to the state health department for information and guidance on that because they wanted, you know, the Department of Energy and Environmental Protection put out something on Monday, and Demas put something out, and still nothing from the health department. So, you know, by mid-afternoon on Wednesday, they finally got something out, which was pretty good. You know, but gosh, you know, again, you know, to be ready for this stuff from the state health department is so important. And because, you know, communities need that. And, you know, we don't want to have, you know, Norwalk closing schools or telling people, kids not to go outside and, you know, everybody doing something different because we're all faced with the same problem. So it shouldn't be individual communities making these decisions in their own little environment. We should all be on the same page, and it should all be led by the state health department. It still didn't really happen that way, and it's, you know, but I think, yeah, thanks, Mac. We tried to be proactive on it as best we could with the information that we had. And as I said, fortunately, the next day, it wasn't that much of an issue, but we were also in direct contact with superintendent of schools, you know, and our parks department. What do we do? Do we have pickleball tonight? You know, really, these, you know, in tennis courts, we sent out a notice to the country clubs and on that Wednesday. You know, we wanted to make sure everybody, again, not telling them what to do, but providing advisories to people. You know, there's a problem here, and it may affect you. And oh, by the way, we have masks if you want them. And we did. We brought up some masks, and I think we gave away about 10. So it wasn't like they were in big demand, but we had them. I do anticipate that unless we get some significant rains pretty soon, we're going to be in a drought situation, and we'll be facing some additional water restrictions and irrigation restrictions. I'm surprised I haven't heard anything yet, but I guess the reservoirs are still pretty full. We just haven't had a lot of rain, and so it's imminent unless it does happen. Now, Mac, you had, I don't know, anybody want to go any further on the air situation than from last week?
Well, if you had the pod, we could have rolled that out, maybe gotten more masks out.
Nobody
But
wants.
that was an unusual
even-
event.
You know, there were some people, I will say, you know, I take mass transit, and you know, there were people, more people that day wearing masks than I'd seen in a long time. So, you know, there's an awareness of it now. And the one thing that I did do was, I don't know if anybody follows the health department Twitter account, but I put multiple notices on there about this is a good time to quit smoking.
Yeah.
Yeah,
Well, the club that I go to, the Rowan Yacht Club, did close. Maybe as the result of your communication. And I saw it happened to be the evening of my wedding anniversary, and I hadn't got a gift yet. And I did find a number of stores in Darien had closed early as well.
But we didn't have anything to do with that.
David,
So,
you know,
and I was wearing a mask.
and that day, my concern was, as you know, where you put in Darien versus the Zip, getting two different air qualities. You know, the one coming out of Greenwich was for ozone. So if people looked at that, where I saw these kids down, you know, across the street playing early, it said air quality good. If you put in Darien, you know, where it said put in, you know, Zip or City, and then you just got the ozone. But if you put in the Zip, as we found out, you get it coming out of Westport, and it said the particulate matter, it was bad air quality or whatever, a different rating. So I thought that was very confusing. Did you understood that, right, when you saw that?
Well, you know, when I first went into the website, I saw the same thing you did, in particular, and I said, "Oh, that can't be." So I put in the zip code. I just,
Yeah,
you know,
but
I
how
just
about
did
the
that.
general public? Right. You put
Yeah,
in,
well, that's what.
yeah, when you're looking up air quality, they may not realize the difference between ozone and particulate, what in that, you know, day of what we were concerned about. And if they see, oh, air quality was good because it's showing the ozone, and not because they put in the word Darien, I think that's really confusing. And I tried other places in the country, or people areas that have people where I knew people, they did not have that same problem of having two separate reporting districts.
Well, I can't help their website, you know, and it's hard to provide enough information to people. So, you know, I mean, we figured it out. I think that we have a smart population, and I'm sure that they could. I'm sure they could navigate through the system.
I don't know because I don't know that people,
You know, I can't, you know,
Darien or the Zip. But I think what would be useful is if this comes up again in the future and we see this glitch, is when they do the robocall, you know, just tell people to put in, you know, the Zip or whatever, you know, so there would be consistency about what they're trying to find out. Yeah, because I thought that was not a good thing. We had two different indices.
Okay. You can try to get that message out more clearly.
Yeah, it was just it's a glitch in their program.
Okay. Mac, you had mentioned that you wanted to talk a little bit about noise.
Well, yeah, I received an email from a Darien resident who is very passionate about trying to ban leaf blowers, and I think he's tried to pursue it with the, I guess these are gasoline leaf blowers, and tried to pursue it with the selectmen and didn't seem to get anywhere. And I just mentioned that I'd bring it up at our advisory board of health, and I'm not sure that that's really our purview, but I think it's something that seems to be an issue in various communities. I think Greenwich has looked at it, and I just don't know what the appetite is in our town.
My neighborhood people complain about it. Houses are very close together. It may not have the same kind of insulation. And with those, the gas blowers, I mean, the decibel is very, very bad. And or people, you know, I've seen people with the landscapers, they'll come sometimes with several people using a gas blower on a small piece of property. So it can be very, very not just annoying, but it can be really have a health risk to it.
What's the health risk?
Well, the amount of if you look up the decibels, okay, with some of these commercial gas blowers, I mean, people, it's just really deafening for some people and very can be very upsetting and traumatizing for people, especially when it's close by, and they don't have easy access to pull out a set of, earmuffs, or, you're walking down the street and all of a sudden you get blasted with the leaf blower. So people are concerned.
Well,
I hear it a lot.
there's no question that people don't like leaf blowers. They don't like noise. There's no question about that. I don't like it, but I guess the question is, what's the appetite in town leadership, whether it's a health issue or not? What is the appetite, and what kind of support and health, because we're a data-driven community. So I think we'd have to show either that there's widespread support among from the residents for this, first of all, and then supplement that with some very strong health-related data. And I don't know what Greenwich or Westport, and I think Westport is the other place that has enacted a regulation, have utilized as a basis for making those efforts. But I can tell you, in neither place was it the health department as the originators for those regulations. And I know that especially in Westport, because that's a district. And if it were in Westport, it would be for all the towns in the district. They did not initiate that. That was done either by the Conservation Commission or the residents in the community. Now, I've had calls from residents who have expressed the concerns that, Mac, that you received. And basically what I told them was, you really kind of need to show the Board of Selectmen that there's a groundswell of support for this kind of thing, because it's really hard to come up with quantifiable health impact data. Sure, you can talk about decibel levels, but what's the health impact from those decibel levels? Are people going to the doctors from it? How do we quantify that problem? As opposed to, you have population of 20,000 people, you have 10,000 people who sign a petition, let's say, of support for banning these things. Then you have the question of, all right, well, who's going to enforce it?
Right.
And the town's going to have to go out and buy all new equipment.
It may not be just banning. I mean, there's other kind of options.
No.
Well,
but if you have only gas
Yeah.
equipment, and you want to get rid of the noise, then you have to ban that particular type of.
What's interesting is the specifically the Greenwich ordinance that they're changing exempts the town from it, so they're not, they can continue to use their leaf blowers.
It's kind of hard to
I think
support.
people are in my neighborhood complain about certain times, especially where they might be going all weekend when that's the only time that they have at home, and they want to be in their yards and have barbecue or whatnot. So
I think there are in our town, if not at the state level, there are hours. You can't do it at 4 a.m. And I'm not sure what they are, to be honest with you.
I think it's 8 to 8 or something like that.
Yeah.
It's 365 days a year noise can be made, so people are getting a little
Well, then okay, so in the wintertime you shouldn't be using snow blowers. I mean it's, where do you draw the line?
No, they don't. No, they're not saying that. It's just that people want to be out in their yards in the summer and the good weather, and so they may make a complaint about some of the noise, and want limited hours.
Mhm.
That we don't have the blue laws still. They would love them in my community.
Well, I think, David, your point's well taken. You really need a groundswell of people and go to the selectmen, and then they have to champion it. And then it goes to the RTM, we would be asked to craft an ordinance, and it would go through those channels.
Yeah, I really think that's the real way to make this happen, and I think that's what's happened in the other communities. The residents have, it's part of that grassroots, making change happen, from the bottom up, because that's really what this should be, rather than, if we from the top down, the majority of people in town may not support this, and okay, it's a health. It irritates people, it disturbs people, and some people can really have an issue with it. But then there are those who live near the train tracks and have to hear the whistle go
Right.
off. And there's all kinds of other things that we have to deal with, motorcycles that go by without mufflers, and so it's
And a lot of these things are exempted.
Yeah.
When you read it, cars on the highway are exempted from any noise ordinance.
So, yeah, I think it's a discussion that isn't going to go away. There's no question about it. And so I think that it does have to, I think, stem from the residents, though. I really think that that's in order to gauge the amount of support for this. I can tell you there's no appetite, because I brought it up at a recent meeting with the first selectman and town administrator.
Okay, well, that's good to know.
It's
And in the paper where I read, I think that where somebody wrote to the letter to the editor, it's a very small piece of property. Some of them, like less than a quarter acre or something like that. And I think those are the people, some of them who might have more of an issue in older homes also, where they don't have the insulation. So I think there's a lot of variability in people's exposure.
Well, the other two is it's a new world. I mean, you have people that are home all day now working. I have a friend who's a landscaper, and he says that he there are customers he's never seen in his life, but now all of a sudden they're talking to him regularly, and they're like, "Oh, Johnny, please, can you not work today? I have a Zoom call going on." So, I mean, there's stuff. It's a different world.
Yeah,
I can't use the phone a lot when
and with that being said, over time, I think you'll see the lawn contractors switching over to the other types of equipment.
Mm-hmm.
I have an electric lawnmower. I have a plug-in leaf blower. It's not as good as the gas ones, but
I have a rake, a few of them.
well, I have a rake too. Because the blower doesn't move the leaves. I have these oak trees. They're big, and the leaves are big. So anyway, All right, folks.
Okay, well, thank you.
The only other comment that I had to, is that, as we all know, I mentioned it briefly before, the public health emergency for COVID-19 has been declared over.
Yep.
Period. That's all I'll say. Thank you for your support during that nightmare, because it was.
Well, and David, thank you for all that you did. My goodness.
Indeed.
Thank you, David. Yes.
Thank you. It was
so much. I really.
It was a great community effort, as we said before. The community responded in an unbelievable way. And, a lot of other towns have established organizations to go out and run those kinds of clinics. We didn't. But we had a great group of people who were really dedicated and were always there. And it's just remarkable. So again, my hat's off to the community. Town of Darien really did a great job.
Only problem I have now is, let's see, 2 weeks ago I had a cold and my kids insisted that I get a COVID test. So every time I get a cold now, I have to get a COVID test.
That's the first thought everybody has, right? And I had allergy issues, and my wife was saying, "Are you sure you don't have COVID?" Okay, I'll test just because, just to make sure. Yeah, no.
Gang, our next regular scheduled meeting is September meeting, believe it or not, which is Tuesday, the 12th of September at 5 p.m.
What was that date, Kevin? I'm sorry.
I believe it's Tuesday, the 12th at 5 p.m., right? It's the second Tuesday of the month.
Okay.
Let me just see if I have that right. Yeah, June.
Yes, I have that on my calendar
Yep.
already.
That's it.
Yeah.
5 p.m.
5 p.m.
David, thank you again for all the wonderful work you and your staff do. And thank you for
Pass that along
this.
to them.
And David, we need to connect on pod building, and we'll connect on a potential letter of support from the ABH.
Okay. Appreciate that.
Thank you, gang.
All
Thank
right.
you.
Thanks, everybody. Take care. Talk to you soon.
Cheers.
Bye.